Let's continue. The lawsuit claims that Dr. St. Julian did not tell Ross and her family about the decapitation when she spoke to them at approximately 5 a.m. on July 10. The lawsuit also claims the hospital discouraged Ross and the baby's father, Trevion Taylor Sr., from seeking an autopsy, saying a free autopsy was not an option for them under the circumstances. Instead, they reportedly encouraged the couple to have their son cremated instead of being sent to a funeral home. When Ross and Taylor demanded to see and hold their child, the baby was reportedly tightly wrapped in a blanket with his head propped on top of his body to conceal the fact that he was decapitated. In the other article, the ABC article, it stated that they saw him only through a glass window. You know how they have those glass windows in the nurseries at hospitals. But this seems to indicate that they were able to hold him, but that they wrapped his, they wrapped his body tightly in a blanket. The family was ultimately told about the decapitation by the funeral home, according to the family's lawyer. Willie A. Watkins Funeral Home also contacted the Clayton County Medical Examiner's Office on July 13. An investigator was assigned to the case and reached out to the GBI Medical Examiner's Office to ask for help from his pediatric forensic pathologist team in performing an autopsy, which took place the next day. After reviewing the preliminary results of the autopsy, investigators reached out to the state agencies overseeing the doctor and nurses who were on duty during the birth. The Clayton County Police Department also launched its own criminal investigation. The Southern Regional Medical Center released a statement after the incident saying the infant's death occurred in utero prior to the delivery and decapitation. They also said that the doctor who delivered the baby, Dr. TRACEY St. Julian, is not and never has been an employee of the hospital. Like I said in another video, that just means that she's in private practice. She delivers at the hospital, but yes, she's not an employee. The hospital does not pay her. She does her own billing to insurance companies for the hospital, or for her patients. But she works at that hospital. She delivered my baby at Southern Regional. She works at that hospital and is known to work at that hospital, even now. Okay, so the lawsuit asked for Ross and Taylor to be compensated for the suffering and death of the child and the tremendous mental and physical anguish and trauma experienced by Ross and Taylor, who was awake while and Trevion, who was awake while the doctor was attempting to remove the baby. The lawsuit alleged Dr. St. Julian failed to practice according to medical standards when she grossly negligently applied excessive traction on Trevion Isaiah Taylor Jr.'s head and neck, and grossly negligently failed to do a cesarean section in a timely and proper manner, resulting in Trevion Isaiah Taylor Jr.'s decapitation and death. The lawsuit also says Premier Women's OBGYN LLC is liable for the grossly negligent acts and omissions of its employee and or agent, TRACEY St. Julian, MD, who cared for Miss Jessica Ross and Trevion Isaiah Taylor Jr. on or about July 9, 2023. Additionally, several nurses were also accused of gross negligence. I believe it, because they reportedly did not follow proper procedures once it was determined that a shoulder dystocia had occurred. I believe it. According to the complaint, the nurses owed an independent duty to the Ross and her baby. The complaint is also seeking to recover damages for the full value of the baby's life, including loss of earnings and loss of enjoyment of life. Listen, those nurses laughed at me while I was in pain. I believe everything they're saying about the nurses. Dr. TRACEY St. Julian is different. I thought she was a great doctor. I had to have a C-section. She came in, took one look at the strip and was like, let's go to C-section. I was going to argue, then I said, let me shut up. I'm an OBGYN, but I'm also a patient, and I better just listen to my doctor. And I'm glad I did, because the baby was big, like almost 9 pounds, had meconium, the baby was stressed. But those nurses laughed at me. I was crying in pain, and they were laughing. They were laughing. Now who's laughing? Yeah, I remember you. I remember you all. You took me to the bathroom. I told you my water had broken. I don't know, I've practiced for 20 years, maybe 10 years at that time, but still. Someone tells you they broke their water. You lay them down on an exam bed, put a speculum in, see if there's fluid, see if there's pooling. You take a sample, put it on some nitrazine paper, see if it turns like a purple. And then you can also put it on a slide, look under a microscope, and you have something called ferning. They took me to the bathroom, told me to pull down my underwear, and use nitrazine on my own underwear. I'm not even sure if they gave me nitrazine or they just said, let me look and see if there's fluid there. The wonderful doctor, it wasn't St. Julian, it was another doctor that was on call, told them to do an ultrasound, and that's when they found that I had no fluid whatsoever. So I believe the nurses are negligent, have been negligent, are known to be negligent. The chickens have come home to roost. I still don't believe Dr. Tracy St. Julian was negligent. I know you all will say, I'm supporting the doctor, but it's one thing to support the doctor, just a random doctor. I am a big supporter of doctors, but she was also my doctor. I know how she practices. She's a good doctor with good instincts. Something terrible happened. Nurses. No, I'm joking. Oh, God. Okay. Let me see. Okay, where's that? So where was I? Okay. The complaint is also seeking to recover damages for the full value of the baby's life, including loss of earnings and loss of enjoyment of life. The other thing is that, during a delivery, it can look crazy, especially a shoulder dystocia. Nurses are jumping on you, or supposed to be jumping on you. I don't know what the Southern Regional nurses did, but like the nurse I had just this morning, you get a stool. Like if I see a shoulder dystocia is about to happen, I tell the nurse, get a stool. Because they need to get up on the bed. I'm tallish, taller than most of the nurses usually for whatever reason. A lot of nurses are short. I'm not sure why. And so the bed is up because it has to be at my level to do a delivery. So get the stool so that they can get up on the stool and get up over the mother. This is the pubic bone. So mother's legs are this way. This is the pubic bone. You have to get at a 90-degree angle and press down on that suprapubic bone. So I'm already like, get the stool. And, to the outside world, to people in the room, it looks like you're jumping on, the mother, punching her maybe. You're pulling, that baby's head is getting sucked back in. Mom is screaming because it's like, what the hell? Fluids flying everywhere. The nurses, the baby nurses are scuttling around. It is chaos. It is chaos. That's why I don't know that a patient, certainly not a patient's, FOB, father of the baby, who are usually useless at best, can really independently assess. And this was their first baby, and they're very young. I'm not saying, I feel so bad for them. This is horrible. Something went very wrong. I'm just saying, just give it a chance for Dr. Tracy St. Julian to tell her story. If they want me to come defend her, I will. I'm not defending Southern Regional and their nurses who laughed at me in labor. Laughed at me while I was screaming. My incision I felt like it was tearing apart. My prior incision. So this was my second baby. So, I was having labor, having contractions. I called my friend. He'll vouch for me. I feel like my uterus is tearing apart. My poor mom was there watching me, and they're laughing at me. They were 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 laughing. I will never forget. I will never forget it. Black nurses, too. They were laughing at me. They were laughing, laughing, laughing. We can see you laughing, nurses. I know I'm not the only one. You were laughing at me. Laughing. What's funny? I was in so much pain. I literally felt like my incision was tearing apart. Come in. Okay. So yeah, that was not funny at all. Dr. Tracy St. Julian, I still think is a good doctor. Bedside manner, maybe not so great. Not the most cuddliest of doctors, but clinical acumen, top notch. Top notch. She's a good doctor. She's a good doctor, I think, my opinion. Yeah, bedside manner, really. But, you know, would you rather have a doctor that knows their stuff, but maybe is a little cold, you know, bedside manner? Or would you like the jolly doctor, like, hey, you know, is there for you for 1 hour but then botches your surgery? They actually find that doctors who are nicer get sued less, regardless of how good of a doctor they are. So they may get your prescription wrong and stuff, but they're nice. What would you rather have? I should do a poll. All right, let's go on. So the Clayton County ME determined the specific cause of death of Trevion Taylor. According to the report, his death was caused by a fractured dislocation with complete transection of the upper cervical C1 to C2 spine and spinal cord. It was caused by shoulder dystocia, arrest of labor, that means labor stops, labor can't progress, and fetal entrapment in the birth canal. So note that they're saying complete transection. So completely transected the bones, but still, does that mean that you can break a bone, but does that mean that the entire thing, skin included, is cut off? I can't imagine. I've seen it happen with like younger, gestational age babies, but a full-term baby. Other significant conditions contribution to death included pregnancy-induced diabetes. You know, this is the first. I think this was the first article I saw that said that she had diabetes, but I knew just by looking at her, her size. Hold on, I think someone is here.